It takes less than a second. You might not even notice it happening. But that quick mosquito bite could be the start of one of the most common illnesses on the planet. Right now, roughly 4 billion people, about half of everyone alive, live in places where dengue can spread. That's over 130 countries around the world. 2024 was the worst year for dengue ever recorded. Over 14 million cases and more than 12,000 deaths reported across more than 100 countries. And it isn't slowing down. So what actually is dengue? It's a viral infection you catch from the bite of an infected mosquito, not from another sick person. There are 4 different versions of the virus, called serotypes, which is exactly why you can catch dengue more than once in your life. Dengue used to be thought of as a tropical problem. Not anymore. Rising temperatures and city growth have let the mosquitoes that carry it spread into new regions, including parts of Europe and the southern United States that never used to see local cases. Look at the trend line, and it's hard to miss. Global dengue cases have climbed sharply over the past 2 decades, with the steepest jump happening in just the last 5 years. Myth: dengue is only something that happens somewhere else, in poor or rural areas. Fact: dengue thrives in crowded cities, and outbreaks have hit wealthy, modern urban centers just as hard as anywhere else. By the end of this video, you'll know exactly how dengue spreads, how to recognize it early, which warning signs mean go to the hospital now, and the simple habits that can protect your whole household. Dengue is common, it's spreading to new places, and, most importantly, it's largely preventable once you know what to look for. Here's the full cycle. A mosquito bites someone already infected with dengue, picking up the virus along with their blood. The virus then needs about a week to multiply inside the mosquito. After that, every person that mosquito bites is at risk of getting infected too. The culprit has a name, Aedes aegypti, and its cousin Aedes albopictus. These mosquitoes are small, dark, with distinctive white markings on their legs. And unlike the mosquitoes that buzz around at night, they're most active during the day. 3 habits define this mosquito, and all 3 matter for your safety. It bites mainly at dawn and dusk. It prefers to live indoors and around homes rather than deep in forests, and it lays its eggs in still water, even tiny amounts. You don't need a swamp for these mosquitoes to breed. A discarded bottle cap, an old tire, a clogged gutter, or a saucer under a plant pot holds more than enough still water for hundreds of mosquito eggs to hatch. Myth: if someone in your house has dengue, you'll probably catch it from them, like a cold. Fact: dengue does not spread directly from person to person. You need a mosquito to carry it from one person to the next. A few rare exceptions do exist. A pregnant woman can occasionally pass dengue to her baby, and there have been very rare cases linked to blood transfusions or organ transplants. But everyday contact with an infected person is safe. Dengue risk isn't constant year-round. It spikes with the rainy season, when standing water is everywhere. In many tropical countries, cases surge for months after monsoon rains begin. Here's something worth knowing. The exact same mosquito that spreads dengue also spreads Zika and chikungunya. Protecting yourself from one protects you from all 3. No mosquito, no dengue. Every prevention tip in this video traces back to that one simple fact, which is exactly why recognizing the mosquito's habits matters so much. Dengue has an old nickname that tells you everything: breakbone fever. People who've had it often describe the joint and muscle pain as feeling like their bones are breaking. Dengue illness generally moves through 3 phases. A febrile phase with sudden high fever lasting about 2 to 7 days. A critical phase right as the fever breaks, when warning signs matter most. And finally, a recovery phase over the following week or 2. The most common symptoms cluster together: a sudden high fever, often 104 degrees Fahrenheit or higher, a severe headache, pain behind the eyes, deep muscle and joint aches, and sometimes a skin rash that appears a few days in. That pain behind the eyes has a name too: retroorbital pain, meaning literally behind the eyeball. Combined with deep joint pain, it's one of the more distinctive clues that points toward dengue rather than a typical flu. Your symptom checklist: sudden high fever, severe headache, pain behind the eyes, joint and muscle pain, nausea or vomiting, and a rash that can appear on the face, chest, or limbs a few days into the illness. Symptoms typically begin 4 to 10 days after the mosquito bite, meaning you might not connect the dots to that trip or that itchy bite from over a week ago. Some people also notice a brief dip in fever around day 3 or 4 before it climbs again. Keep these symptoms in mind. because next we'll cover exactly when this common, usually mild illness can turn into a medical emergency. Dengue gets mistaken for the flu constantly, but there are real differences. Flu rarely causes pain behind the eyes or a rash, and flu symptoms usually build gradually. Dengue tends to hit hard and fast, with a very sudden, very high fever. Meet Maria, a 32-year-old teacher. 5 days after a weekend trip, she wakes up with a 103 degrees Fahrenheit fever, a pounding headache, and pain so bad behind her eyes that she can't look at her phone screen. By day 2, her joints ache so much she can barely climb stairs. Most dengue cases follow this pattern and resolve with rest at home. But a smaller number take a dangerous turn, and knowing the difference could save a life. The reassuring news first. The vast majority of people with dengue recover fully with rest and fluids. But a small percentage develop severe dengue, and recognizing the warning signs early can be the difference between a scare and a tragedy. In severe dengue, blood vessels start to leak fluid into surrounding tissues, and the number of platelets, the cells that help blood clot, drops sharply. That combination is what causes the two hallmark dangers: fluid buildup and unusual bleeding. These are the warning signs that mean it's time to get medical help right away. Severe belly pain, vomiting that won't stop, bleeding from the gums or nose, feeling unusually tired or restless, and rapid or difficult breathing. If dengue progresses to shock, the body shows it. Blood pressure drops, the pulse becomes fast but weak, and the skin turns cold and clammy. This is a true medical emergency requiring immediate hospital care. So how do you decide what to do? Mild fever and aches with no warning signs. Rest at home and monitor closely. Any single warning sign from that list, go to a hospital the same day. Signs of shock, call emergency services immediately. Certain people face higher risk of severe dengue. Those getting infected a second time with a different strain, infants and young children, pregnant women, older adults, and anyone with an existing condition like diabetes or heart disease. Here's a detail that surprises a lot of people. Your first dengue infection is often milder. It's typically the second infection, with a different one of the 4 virus types, that carries a much higher risk of turning severe. Left unrecognized, severe dengue can lead to dengue shock syndrome, internal bleeding, and organ stress, and in rare cases, it can be fatal. This is exactly why the warning signs matter so much. Use this simple flow whenever you or a family member has a fever that could be dengue. Does the fever come with severe pain or a rash? If yes, get tested. Any warning signs at all? Go to the hospital, don't wait it out. Knowing these warning signs isn't about panic. It's about knowing exactly when a common illness needs urgent attention. Next, what actually happens once you see a doctor? At the doctor's office, expect a physical exam plus a blood test. Early on, a test called NS1 can detect a piece of the virus itself. A bit later in the illness, blood tests look for antibodies your immune system makes in response. Quick pause. If this breakdown is helping you, take a second to hit like and subscribe. It genuinely takes a lot of effort to make videos like this, and your support keeps them coming. The NS1 test is quite good at catching dengue in the first few days of fever, which is exactly when it's most useful for guiding your care early, before warning signs would even show up. Doctors track 2 numbers closely: your platelet count, which can drop as the illness progresses, and your hematocrit, a measure of how concentrated your blood is, which rises if fluid is leaking out of your blood vessels. Here's an important reality check. There is no specific antiviral medicine that cures dengue. Treatment is entirely about supportive care, helping your body manage the illness while it runs its course. For fever and pain, paracetamol, also called acetaminophen, is the go-to choice. It calms your body's fever and pain signals, and importantly, it doesn't interfere with your blood's ability to clot. What you should actively avoid: aspirin, ibuprofen, and other NSAIDs. Since dengue can already lower your platelets and affect clotting, these medications raise your risk of dangerous bleeding. So skip them until a doctor confirms it's safe. Your home care checklist while recovering: rest as much as possible, drink plenty of fluids, water, oral rehydration solutions, and coconut water all work well. Use only paracetamol for fever, and check in on your symptoms at least twice a day. If dengue does become severe, hospital care usually means careful fluids to replace what's leaking out, close monitoring of platelets and vital signs, and in some cases, a blood or platelet transfusion. Most people who reach this stage still recover fully with prompt care. The outlook is genuinely encouraging. Most people, even those hospitalized, recover completely within 1 to 2 weeks, though fatigue can occasionally linger for several more weeks after. Supportive care, the right medication choices, and knowing when to seek help. That's the treatment playbook. Now let's talk about stopping dengue before it even starts. Everything so far has been about recognizing and responding to dengue. Now for the part that matters most, how to actually prevent it. Start with a walk around your own home. Check anywhere water can collect: flower pot saucers, gutters, buckets, old tires, even bottle caps. If you find standing water, empty it. This single habit, done weekly, is one of the most effective things you can do. For personal protection, for things work well together. Insect repellent containing DEET or picaridin on exposed skin, long sleeves and pants during peak biting hours, window and door screens, and mosquito nets if screens aren't available. Not all repellents are equal. DEET-based repellents remain the most thoroughly studied and effective option, with picaridin close behind and a good alternative for those who prefer a lighter feel or scent. Picture your home before and after basic mosquito proofing. Before, open containers and unscreened windows invite mosquitoes right in. After a simple weekend of fixes, screens repaired, containers emptied, that same home becomes dramatically less inviting to them. Think of prevention in 3 layers. Personal steps like repellent and clothing, household steps like emptying water and repairing screens, and community steps like local vector control programs. All 3 layers working together offer the strongest protection. Communities that commit to organized mosquito control, clearing public breeding sites, targeted larvicide use, and even releasing specially treated mosquitoes that block virus transmission, have seen real, measurable drops in dengue cases over time. In areas where these community-wide efforts have been sustained, dengue transmission has measurably declined. Proof that prevention isn't just an individual responsibility, it works at a population level too. If you're expecting a baby or have young children at home, extra precautions are worth it. Keep infants under mosquito nets even during daytime naps. Dress them in light, loose long sleeves, and use age-appropriate repellents as directed by your pediatrician. We're past the halfway point. Next, let's talk about vaccines and the bigger global picture. No single tip prevents dengue on its own. It's the combination, personal, household, and community, that actually breaks the cycle. Good news on the horizon. Dengue vaccines now exist, and they add another layer of protection on top of everything we've already covered, though they don't replace mosquito prevention. 2 dengue vaccines exist today. The newer one, Dengue, can be given to people regardless of whether they've had dengue before. The older one, Dengue, is only recommended for people who've already had a confirmed prior dengue infection. The World Health Organization recommends dengue for children ages 6 to 16 in areas with high dengue transmission, based on clinical trial data showing meaningful protection against symptomatic dengue and hospitalization. Wondering if you should get vaccinated? Start by checking whether dengue vaccines are approved and available where you live. Then talk to a healthcare provider about your age, prior dengue history, and local transmission risk. A few precautions matter here. Dengue can actually raise the risk of severe dengue if given to someone who's never been infected before, which is exactly why prior infection confirmation is required for that particular vaccine. Vaccine availability is expanding fast. Dengue is now approved in more than 40 countries, from Indonesia and Brazil to much of Europe and, as of 2026, India, with more countries adding it to their programs each year. Beyond individual health, dengue carries a massive global cost. Billions of dollars in healthcare spending and lost productivity every year, on top of the human toll of millions of cases and thousands of deaths. Getting a vaccine like dengue approved took years of careful testing. Small early safety trials, larger trials checking effectiveness, and finally massive real-world trials involving tens of thousands of people before health authorities gave the green light. Weighing vaccination. On the plus side, meaningful added protection in high-risk areas and reduced hospitalization risk. On the other side, it's not 100% protection. Availability and eligibility still vary by country, and it never replaces mosquito prevention. Vaccines are a genuinely exciting new tool, but they work best alongside everything else in this video, not instead of it. Almost there. Let's bring it all together with a fast recap you can actually remember. One more number that helps put this all in perspective. The overwhelming majority of dengue infections, roughly 3 out of 4, cause mild or even no noticeable symptoms at all. Quick recap. How does dengue actually spread? Only through mosquito bites, not person to person. What are the classic symptoms? Sudden high fever, headache, pain behind the eyes, and joint pain. What medicine should you avoid? Aspirin and ibuprofen. Stick to paracetamol. And what's the single best prevention habit? Emptying standing water around your home every single week. One more before we go. You have a fever, a headache, and pain behind your eyes, and now you're noticing your gums are bleeding a little. What should you do? Your 4 action steps. Starting today, walk your property and empty any standing water. Apply repellent during dawn and dusk hours. Know the warning signs by heart. And if you or a loved one develops a sudden high fever, watch closely and don't hesitate to seek care. Numbers worth remembering. Symptoms appear 4 to 10 days after a bite. Most people recover within 1 to 2 weeks, and roughly 4 billion people live somewhere dengue can reach them, which is exactly why this knowledge matters. One last memory tool. Think ERPW, empty standing water. Repel with protection. Paracetamol only, never NSAIDs. Watch for warning signs. For letters, everything you need. Dengue is common, it's spreading, but it's also very manageable once you know the basics. Share this with your family. It might just help someone recognize the signs in time. Here are the key references and sources for this video. Thanks so much for watching. If this helped, like the video and subscribe for more clear, simple explainers, and I'll see you in the next one.